get one for that second photograph.
What, did someone say number 2? Yeah, it is number 2. The correct answer is number 2 on both those images. So well done. Might have a super recogniser in the house there. So come and see us.
And just before we get started with the questions, can I just point out you should have a sheet on your table that if you can just give us some feedback on how you enjoyed tonight's talk and whether or not you've got any suggestions as to what sort of talks you'd like to happen in the future, then please feel free to leave us some feedback and we'll try as much as possible to get a variety of speakers in. So anyway, back to Sarah. Have we got any questions?
Can people with
Prosopagnosia.
Prosopagnosia, can they draw faces?
They could draw, they know the eyes go above the nose, above the mouth, so they could draw you a generic face. But if it's like imagining faces, if I said to them, imagine your mum's face and draw me a picture of it, no. Most of them
They can copy a face.
They can copy it. So if that person was stood in front of them, they could do you a drawing. If the person wasn't there, they couldn't do that from memory by imagining that face and putting that person down. Yes, please.
What do you think it is about the eye movement, particularly around the mouth?
It's a difficult one, very difficult one, and we don't, to be honest, we don't really know why they're being drawn to the mouth more than the eyes. What's quite interesting is you see it in a range of other conditions which are also characterised by face processing deficits. So in autistic children, for example, they look more at the mouth. People with schizophrenia tend to look more at the mouth than the eyes. So it seems like it's a biomarker, if you like, for particular conditions, but what's causing that particular bias to the mouth is probably different in each of those conditions. Now, when we've actually asked our participants if they're aware of what they're doing, some of them actually say yes, and they say, if you're looking at somebody and you have a problem with face recognition, what you tend to do is you look at them for a much longer period of time than what a normal perceiver would, if you like. That's classed as rude in our society. So if you start staring at somebody in the face, you get quite a negative reaction back, particularly if you then perhaps fail to recognise them. So some prosopagnosics actually say, rather than staring at somebody in the eyes, what they tend to do is use the mouth because it's not quite as threatening towards that person that you're looking at. But to be honest, the answer to your question is whether it's intentional or not. The jury's still out there, and it's a difficult one to put a scientific interpretation onto. And it's one of these ones where you can carry out all these cognitive experiments, but actually sometimes you just need to sit down and have a good chat with your participant, and that can give you the answer that you're looking for, you know, as opposed to using all these advanced techniques. But I hope we come up with the answer to that in time.
Has anybody tried using any of the complementary medicines that stimulate the brain?
A lady just asked me that in the break actually, and the answer is not that I know of. And the lady I was speaking to before made some suggestions, but something to look into. But as far as I know, nothing like that's been done so far. Thank you.
Is there like a range of how intense the disorder is? Like you said, like 1 in 50. I'm just trying to get my head around that, like, because I know more than 50. I know a lot more than 50 people. So surely I know a lot of people who have like this. I've never ever heard of someone saying, "Oh, I just don't recommend faces."
Yeah.
So, like, is it some people are just not very good at it, or are some are just completely bad?
Well, this is one of the key research questions that we're trying to answer. With many cognitive abilities, we kind of look at people along this bell curve. So most people perform at this level, and then tailing off you get people who are very good but much fewer, and you get people who become very bad and there's much fewer of those. So you get this kind of normal distribution bell type graph shape, if you like. Now what we're interested in as researchers is to answer this question. So with developmental cases of prosopagnosia, is it simply that we're sticking a label on those people who are at the very bad end of face processing. So you take anything, you take language processing, you take reading, you get your good readers and you get your bad readers. So are we in essence socially constructing a disorder, if you like, and we're taking the bottom 5% of people and saying you have a condition? Now, that may be the case, but what work like our eye movement work is doing is it's saying, well, actually there's something different about these people. It's not that they're simply poorer at it, but they're actually doing something different. Their processing strategies are different, so they're doing something qualitatively different in the way they process faces. And if we were to take brain scans of those people, what we're interested in is that face area of the brain here, is that in some way not functioning properly, rather than just it's functioning slightly less than everybody else? Is it doing something completely different? And this is a key debate in the literature at the moment, and I'm glad you brought the issue up, because it's something that we're very tuned into, and this is why we really want to find those people at the top end, these super recognisers as well, because maybe they're just the opposite to prosopagnosics, they're just the other people at the other end. What we're finding, and my PhD student Anna at the back will kind of testament to this, we're finding it really hard to find really good people, and Anna's tested quite a lot of people who think they're super recognisers and found, I think, one person, she's at 3 now, we'll be on 3, as opposed to the hundreds of prosopagnosics that we've got coming through the door. So this is why it's really important for us to get those people at the top end as well, because theory says there should be the same number at the top end as there are at the bottom end. So, does that answer your question? Yeah. Lady in the purple?
Sorry, just what you were saying about super recognising. I'm sure I've read recently that in the police force, there are certain members of the police force who are super recognisers, and they deliberately use them in certain situations because they can remember huge amounts of faces at a tube station. They can remember every single one that goes past. Is that true?
Yeah, Anna, do you know the details of that particular report?
I think it's very similar to police officers in the Metropolitan Police in London. But this is another part of the research that we are trying to look at, whether the definition of super recognizers that we have at the moment is mostly theoretical and based on academic work. We are not sure whether the same definition that applies to our circumstances applies in real life. So that's something that I'm trying to look into. But I know I was trying to get in touch with the political.
Yeah, because you wonder where did they just notice that some policemen were just very good at remembering faces, or how did that arise?
I think it happened during the London riots that some police officers turned out to be very good at spotting the people who were captured on CCTV and on very degraded images, and they were able to recognize them then on the street from different viewpoints and from different angles and things like this, and that's how they got them. And now they're using the officers for different tasks and different investigations. So that's how the list was constructed now.
So I think there's a lot of applied value in actually working out, can we isolate people in society who are very, very good at face recognition, and can we use them somewhere quite important, like passport control? Yeah. I mean, you think about what we've talked about tonight so far. There's so many individual differences in face recognition ability, but society as a whole isn't aware of that, and neither is government, really. So to become a passport control officer, you do not go through a screening process at the moment, in the same way that if you're an eyewitness to a crime, your testimony means just as much if you're a prosopagnosic person to if you're a super recogniser, because the courts don't recognise that there's individual variance in face recognition ability. And some of the applied value of the work that Anna's doing is actually to get government to recognise that. Maybe if someone's going to serve as an eyewitness in court, we need to screen their face recognition ability first, because some people's accounts are going to be more accurate than others, and they're going to mean more. In the same way, I mean, we need to have people who are good at face recognition in passport control and in these key positions in the police force as well. So it's a really, really important issue, looking at both ends of that spectrum and putting these people hopefully to good use in society. And it also raises the bigger question, which Anna's also interested in, which is, can we create super recognisers? If we get to understand why people are very good and why people are very bad at face recognition, not only can we improve face processing in clinical patients, that maybe we can train people involved in the police or in these key kind of forensic positions to be better at face processing. And that in itself is really important. Maybe it's not about just being able to pre-screen and pre-select people, but can we put them through a certain amount of training to make them better at their job? So there's so much room. In Anna's 6 months into her PhD, and this is something not a lot of people have been looking at to date, so we're hoping this will go on to big things.
Second session.
Another one? Yeah.
How, because machines kind of can recognise, they usually just take measurements, don't they? And are we, are people who have that word, I can't pronounce,
Prosopagnosia.
yeah, worse than machines kind of at recognising? Or is it
It's
different?
computer face recognition is a really difficult subject at the moment, and I think am I right in saying Heathrow have now got some sort of recognition system? Gatwick has.
But there are still passport officers behind the gate because from what I've seen, but that's only judging by its face value, on about 50% of occasions, still passport officer has to do the face matching because something doesn't work, even in the passports you can go to the gate.
I think the kind of main point which we're starting to realise at the moment is computers cannot replace humans when it comes to face recognition, and it's very misleading because you watch some of these CSI type programs and they've got these computerised face recognition and suddenly they've got your suspect based on goodness knows what. It's not like that in reality, and from what we hear from our kind of computer colleagues, if you like, we're nowhere near creating a computer system which is anywhere near has the ability of a human brain to recognise faces. So what probably that means is either we do understand what underpins human face recognition, but you simply can't get a computer to replicate that process, or we haven't fully understood it yet and kind of mapped that on. There's still a very, very long way to go. So humans at the moment are winning the computer battle, so still jobs out there.
Is it gender balance, the ability or the, like the super ability or the not ability? And are men easier to recognise than women or people of a certain type?
Yeah, what we don't know at the moment is whether in general super recognisers there's more men than women, if you like, out there. As Anna said, she's only actually found 3, so we need to find a much larger sample to be able to answer that question. But what we do know at the moment is there are own gender biases in face recognition. And basically both men and women are equally as good at recognising male faces, but men are slightly poorer at recognising female faces. And you might tend to think of an evolutionary explanation there. But it's very small. It's a very small difference, but there is a reliable explanation.
Were those faces only on the right side of the brain, or is it just you pointing out ones on the right?
There's a greater bias to us using the right side of the brain. There is an equivalent face area on the left side of the brain, but we don't use it to such an extent as the right side. So you tend to see damage to the right side of the brain in people who go on to have prosopagnosia.
Because when I was married, my husband had some kind of acquired dyslexia and some kind of thing, but he was really artistic and he could just see if something was going on and he wanted to report it to the police, he'd be able to go, remember the face, draw it, fantastic. But there were a lot of other things associated, that didn't go with that. So I don't know, I was thinking that he seems to go against what you're saying in a way, that he had this really super ability to just draw a face that was really accurate after only contact with for a few seconds. But he had some unrequired dyslexia.
Yeah, I mean, if he's got other difficulties in other areas, sometimes you do find that people then have a superior ability in something else, and it may be that different brain areas which are normally used for certain abilities might get taken over and used for something else, which might...
I think that's the correct, well, I know both sides are obviously, but people talk about drawing on the right side of the brain creative things. So could exercising that creative side of the brain help this or people with this?
I think that's probably maybe an oversimplified way of maybe representing the brain. It's a lot more complex than just looking at the right versus the left side. But definitely those types of techniques are ones that we need to explore. So if we encourage people to actually promote their creative sides and explore their more artistic sides, will that have a knock-on effect to face processing ability? Particularly in children, these types of arts therapy, they might be, particularly suited to this type of thing. So I don't have the answer to that question, but it's a very good point. Yes.
Sorry, another one for me. And finally, in psychology, they're always doing twin studies.
Mhm.
Finally, there's a different thing we can do with twins. You could get people, because mothers who have quads or something, and we can't tell them apart. Sometimes their parents can't tell them apart. That one who shaped numbers into their kids' hair, so that. That's a really, really difficult test, isn't it? Right, here's a set of 4 people who are identical genetically.
Yeah.
Can you tell them apart?
Yeah.
You could do kind of interesting.
Yeah, I mean, definitely one for this to detect the super recognizers. The one that we tend to use at the moment is not only a really difficult face learning test, but we do one of these before they were famous tests. So you get these sometimes in pub quizzes, and it's a bit popular psychology, but actually it's a fairly good test of how good someone is at face recognition skills. So in my lecture a few weeks ago with my undergraduates, I popped up a picture of Brad Pitt as a baby, and 70 odd students in the lecture theatre. Who is this? One person called out Brad Pitt, and I'm still waiting for them to come and see me, and they haven't. But I wouldn't have known. I wouldn't have known that was Brad Pitt. So those types of tests are definitely what we can use to screen people and really test if they are exceptional at face
I'm
recognition.
usually quite good at that. Who did this baby work to be? I can usually do it.
You have to sequence, yes.
Or maybe I just remember the ones that I did.
Yeah. The super recognisers, they tend to be people who, they say they walk past someone in the street and they said, that person was in my class at primary school. Years and years and years ago. So someone who's in their 40s or 50s maybe. And they say, yeah, I knew that person when I was 5. And then, of course, the person would have grown up and changed, and many people wouldn't have recognised them. But that's kind of the types of reports that we hear. Things like that. So, yes.
I have a couple of questions. One is kind of going back to the man-woman thing. Is it worldwide condition, or is it Caucasian, European?
It is worldwide, it's been shown in Japanese and Chinese cultures as well. Caucasians, and interestingly, all the various different Caucasian countries. So we've got reports in Australia, we've got reports in America, obviously the UK. Through our website, we've been contacted from people, India, so on, all over the world. So it definitely seems to be a world, a cross-cultural difficulty.
Okay. This is the first I've kind of come across this, and the impression I got was that you don't recognise the face structure, so eyes, nose, mouth. Yet the Abby Joey story you said, he recognised the Chinese nursery kids.
Yeah, so
they had 2 Chinese kids, would he not tell the difference?
No.
But he can see that there's a different face shape,
Yes,
different eye
exactly.
shape, etc.
Yeah, and probably a different skin tone, and perhaps hair colour as well. So kind of external features would also have contributed. The other information you don't get on there is accent as well, and it may have been that the voice contributed to that too.
I was going to say whether that was something to do with them looking at the mouth. Was it maybe they were hoping that they would talk so that they
possibly.
could recognise the voice?
Possibly. And lip speech is really important as well. And the other thing is, you tend to not get much motion around the eyes. So the eyeballs move, but unless people really kind of put a very angry expression on or extremely happy expression on, you don't get that much motion. But people actually have very distinctive mouth movements. So when they speak, you get people who might talk slightly out of one side of their mouth, or just make more. You've got more going on here, motion-wise. And there's been quite a lot of research, and we did a study actually last year where we found prosopagnosics are very good at using motion to help with face identification. So what they might do is they can't look at a static face and know who it is, but But if you then showed them a video clip of that person talking, they'll say, I recognise the way that person's forming their words.
Without the voice.
Without the voice, yeah. Yeah, so they become very good at it. So, yes?
And I would say I also recognise something when they're walking.
Yes, absolutely, absolutely. Yeah, we hear that an awful lot, that people like to use gait and the way people move and walking to recognise. So definitely.
What do you do to help your patients when they come to you? Do you wear name badges or the same?
Normally we're in one-to-one sessions, so there's no need for that. We did go, the last couple of years we've been to a big event where prosopagnosics have been brought together for like a public engagement open day, and in that situation we do resort to name badges. And what they also did there was we had, it was kind of academics and face blind people, and we had the academics with a particular colour badge and the face blind people with a particular colour, so you knew the person you were talking to probably won't recognise you again if you saw them later on. So we try and be sensitive to those types of things when necessary. But much of our work is on a one-to-one lab-based setting, so it's not necessary. Yes.
It's quite interesting because you're using photos for identification, which is a very kind of artificial thing, because a human being in front of you has got many more dimensions and sounds and smells and all sorts. So is it different than the more kind of dimensions you put in? Like if you had a 3D head or a real person, do they get different results?
Well, we know that prosopagnosics are bad in everyday life when they have all of those cues to recognition, and that's why they come to us in the first place. At the moment, we only have these static single photograph diagnostic tests, and it's something that Nicola here, who's a postdoc in my lab, we've become very conscious of the need to actually use moving stimuli at least, and it's a project we've got planned for the very near future. So there's definitely a need to translate what we're as existing diagnostic tests into more real life, kind of using more real life images. But I wouldn't imagine there would be a dramatic difference, because these people are coming to us and saying, look, in my everyday life, I just can't do this. I just can't recognise people. But it's important for us to be as ecologically valid or as real life as we can in what we do.
Well, we were talking before, and it's often somebody's voice that triggers.
Yeah.
You're like, oh, I know that voice.
Yeah.
More than, their face. You're like, I know you, but...
Yeah, and what most of our tests try and do is we actually exclude all of those factors. So we give people nothing to go on except the face. And that's what we're interested in, is when you take everything else away, so we cut the hairstyle out even, we take everything out apart from those inner features. Once you do that, is this person still impaired at face recognition? And if they are, it's likely they might meet that clinical criteria for having the condition.
Are these people, have you done that one where you see like a sad face and happy face, and some people can recognise the emotions and some people can't? Have you done that test? So autism again?
Well, there's just a test for if people can recognise emotional expressions.
Yes.
That is commonly carried out with autistic people, and you would normally expect autistic people to be impaired on that test. With prosopagnosics, we actually get a completely mixed bag of findings. So some people will also be impaired at recognising expression, and some people won't. And the reason for that is probably due to what's underpinning their prosopagnosia. It's probably there's a different cause. So for the people who can't recognise expression as well as can't recognise people's identity, they're probably just looking at faces, very strangely. So anything, if I asked them to recognise gender or age, they couldn't do that either. For people who are only impaired at identity, there must be something higher up that's wrong with them. It's not the way they're looking, because if I say to them what expression's on the face, they can do that. So it's not the way they're looking at faces. It's probably something to do with their ability to associate a name with a face. And that's not to say they've got a generalised memory problem. It's absolutely specific to face recognition. So I hope I've explained that clearly. But we absolutely see these different subtypes.
It's kind of hard to get your head around a bit of it.
Is there any, we talked about causative effects and trauma and the like. Is there any sense of just kind of coming on with age, like not not having a problem as a kid, but then as an adult coming on?
In older age there is, and there's what we call progressive prosopagnosia, which is commonly seen in dementia, Alzheimer's and so on. And that's basically where in these disorders certain parts of the brain are actually wearing away, if you like, or they're shrinking. So you do commonly see face recognition deficits in those sorts of people. What you don't get is normally someone who, with developmental cases, who was completely normal throughout childhood, then as an adult suddenly it started getting worse. It's normally lifelong, or at least can be traced back to the early childhood years. With acquired cases, that brain damage could happen at any point in life, so a completely normal face processing system can be damaged at any age, but it's always permanent. So you don't tend to have someone who just has a temporary problem with face recognition. So, sorry, I know you.
Sorry, I was just going to ask, is it the whole face? I mean, if you take, for example, the right eye, you get a dozen right eyes, can prosopagnosia tell them?
Well, interestingly, they're much better at that task. So several or many prosopagnosics actually perform much better if you just give them a single feature in isolation. And that again is evidence for this configurable processing strategy that I was talking about. So in prosopagnosia, the basic hypothesis is they can't use that configurable processing strategy. They can't put together those facial features as a whole. And instead, they just look at the features one at a time. So if you only give them one feature to look at, that's probably the technique they use anyway. So you're actually just kind of facilitating their normal technique, if you like. So what we tend to see is they perform much better in that
context. Configurable processing system almost interfering with their ability to treat it as an object.
Yeah, so it might be that configurable processing system isn't absolutely gone, but it's to some extent damaged, and that's causing that interference. If you can take that out of the equation altogether, they become quite proficient at just doing a feature by feature strategy. So it's fascinating data to look at those effects.
Sorry. Only a comment. There's a program BBC, wasn't there, where there was the New York artist who paints those enormous.
Oh, Chuck Close.
Yeah. And he does separate features because he doesn't see them together, which allows him to paint enormous pictures. Without thinking about how it all works together in the same manner.
Yeah, he's published a book actually about 6 months ago. It's available on Amazon. I'll give it a quick plug because it really kind of illustrates really nicely prosopagnosia, as you said. Because what he does is he takes every little component of the face in a tiny, kind of that tiny sector, and puts it all together. If you were to hold it right back, you can't see it's made of all these tiny little components, because your automatic configurable processing strategy just takes over and makes you process that face as a whole. But it just gives you that insight into how a prosopagnosic person views faces and that different processing strategy that they use. So it's a really good point, so thank you for raising that.
So do you find that you can't have trouble finding people attractive?
Again, mixed pattern of findings there. So some prosopagnosics say they have no idea whether they find somebody attractive or not, whereas others actually seem to perform along normal lines at that. So it's not a condition where we can say every person is exactly the same. There's actually kind of a range of symptoms, which in some people, some are impaired or some are gone and others are preserved. So it's a real, we do see a real variety of people, and that's when Nicola here, who runs a lot of the diagnostic tests sessions, we test everything because we want to know the answer to that question, but we get a real mixed
So some of them are good at am I hot or not, and some of them are. You know that website?
No, I don't. I'm afraid.
A lot of faces pop up and you have to rate them on a scale of 1 to 10 on whether they're hot or not.
Yeah. So in
faces and other parts of the body, I believe.
Oh, right, okay. I have to check that one out. In psychological literature, what we actually find is we all like to think beauty is in the eye of the beholder, and I know some of my students are here and we had this lecture this week, but actually we tend to mostly agree on the faces that we find attractive, and that's why we can actually test prosopagnosics on those issues. So we can compare them to control participants and see if they mostly agree, because most controls do. Attractiveness isn't quite as subjective as what we'd like to think it is. So yes, symmetrical faces we find particularly attractive. But again, we can measure this, and some prosopagnosics agree with what most control participants would find as attractive, whereas others seem to just not be able to do that at all.
I think you said the NHS don't recognise this. Are you working with or at them?
We are currently, we're just about to start a campaign actually, where we have launched an e-petition, and anyone who wants to sign it, please do go to our website. And we have to get 100,000 signatures on our e-petition to get this issue debated in the House of Commons. So we're working with a number of people with Faceblindness, and when our CBBC documentary appears in a couple of weeks, we're hoping to kind of ride on a media wave where we're really going to push for this issue to be debated, and we want to go all the way to the House of Commons and really make our case and bring it up for public discussion. So it's another important side to what we do. It's not just about the research, it's important we do follow those through as well.
Yeah. For example, that's the relationship between, for example, people who are born prematurely and prosopagnosia?
No, not that we know of at the moment. But again, I think it's simply that question hasn't been looked into. So I can't give you a yes or no answer, just simply that hasn't been explored yet. But it'd be interesting to look into that.
Okay, any last questions that just can't wait? Because otherwise I think we might be here all night.
Can you repeat the website name, please?
It's www.prosopagnosiaresearch.org. I'll leave this up if anyone wants to come and note it down before you leave.
I think if you go to either our Cafe Sci webpage, or if you go to our Facebook page, there is a link from the adverts that we put up.
You can just Google Faceblindness or Prosopagnosia Bournemouth University and you'll hit us straight away as well. So, but please, anyone who's interested in finding out more, we're always looking for controls just as much as we're looking for face blind and super recognisers. So do come along and see what we get up to. So, but thank you for being a lovely audience.
Thank you very much, Sarah. That was fascinating. Just a reminder, our next one, hopefully we'll have some people around, our next one is the Tuesday straight after Easter, and you might just recognise the person that's giving the talk, because I'll be giving the talk next time, and I'll be talking about how we perceive vertigo. I'll also be running a little bit of an experiment throughout the evening, so you can come along and take part in the experiment, and we'll be able to see the results coming up as the evening progresses. So hopefully we'll see you all in April. Thank you very much.
Thank you.
Thank you.